Healthcare experts and industry leaders are advocating for a digital revolution in the country's healthcare system. At the Healthcare Providers Association of Nigeria's Scientific Conference, an annual general meeting in Lagos, Professor Akin Abayomi, Lagos State Commissioner for Health, emphasized the need for innovative solutions to tackle the challenges facing Nigeria's healthcare system. Sarah Ayuko has the details.
Still surviving from a brain drain, Nigeria's healthcare system is on the verge of a digital revolution. Here, top experts and industry leaders at the Healthcare Providers Association are calling for widespread adoption of digital solutions to transform the health sector and ensure massive integration of the vulnerable into the health insurance scheme.
The Lagos State government has demonstrated commitment to the NHI Act 2020, 2022, and our home previously Lagos State Health Scheme, which was made mandatory from inception.
This is an opportunity for us to reduce the low enrollment rates. It's very important that Nigerians are educated on what health insurance is, on how they can access it, on the benefit that comes with it, and how it can help improve their life. And we can leverage social media for this. Health influencers, health educators, Facebook groups, WhatsApp communities, TikTok, Instagram content cannot be leveraged.
Out of 25 million people living in Lagos, over 1.8 million residents are insured through private health maintenance organization, with an additional 1 million benefiting from public schemes. The government says it is reinvesting in its equity fund to cover vulnerable residents who cannot afford insurance.
And the challenges of health insurance, particularly social health insurance for us in Lagos, are numerous. Our citizens lack an insurance culture. In other words, whatever the case may be, we prefer to wait till there's a need before you secure some kind of advanced protection against a shock, whether it's a car accident, a catastrophe at home, your life, or your health. And so it's important for government to start to introduce and to promote the concept of insurance, not just for health, but across the board.
Health experts say although a regulatory framework will be established to maintain high standards among accredited healthcare providers, Nigerians should adopt digital technology and health insurance. Sarah Ayuko, TVC News, Lagos.
Vice President Kashim Shettima has led other Nigerian officials to sign a memorandum of understanding between Nigeria and telecom giant Ericsson on a 5G innovation lab. The MOU, signed on Friday at the Ericsson Global Headquarters and Research and Development Lab in Kista, north of Stockholm, Sweden, was witnessed by the Vice President Shettima and Ericsson's Senior Vice President and Head of Business Area Middle East and Africa. Minister for Communications and Digital Economy, Dr. Bosun Tijani, signed the MOU on behalf of the Nigerian government, while Peter Ogundele, Country Manager, Ericsson Nigeria, signed on behalf of the telecom giant. Meanwhile, Vice President Shettima has met with Swedish Prime Minister Kristersson in Stockholm. The high-level talks focused on strengthening bilateral relations with discussions covering trade expansion, strategic partnerships, among others.
For the reforms that is going on in the country and our ambition to raise the level of productivity and make our economy more competitive, it is important that we use the strength of the VP and this visit to truly deepen the relationship, and that's what the VP has done with all the meetings that he's had. So the MOU in particular is very focused on ensuring that Nigeria can make the most of 5G technologies. So we've signed the MOU to set up an innovation lab with Ericsson, and the focus of that lab will be to come up with applications that is based on 5G technologies for things in agriculture, in mining, in some cases education as well, but a general usage of connectivity to improve the quality of lives for our people.